Hi, I am Lindsay Blair, Senior Community Epidemiologist for Lincoln Trail District Health Department. Today, I would like to just share some data from our service area, which was collected in response to COVID-19. These data assist LTDHD in identifying characteristics, health inequities, common risk factors and symptoms, as well as any case clusters. As of 4 p.m. on June 9th, there were a total of 246 cases of COVID-19 in the Lincoln Trail District. The total number of cases per county is as follows: Hardin 120, LaRue 12, Marion 37, Meade 23, Nelson 47, and Washington 7. Currently, there are 231 cases on home isolation or release from monitoring. One strength of local health departments is the ability to conduct public health surveillance, a continuous systematic collection, evaluation, and explanation of health-related data. Over the years, Lincoln Trail District Health Department has monitored the health of its communities through food safety, birth outcome, obesity, smoking, immunization, and communicable disease rates. These data assist defining health problems, guiding resources, and targeting interventions that reduce the impact of morbidity and mortality. COVID-19 public health surveillance in our area indicates that most cases are between ages 20 and 69. The average age of onset is 46.2 years. There is a significant difference in which gender tests positive for COVID-19. Females comprise 61% of the cases in LTDHD compared to 51% of the state's cases. The racial makeup seen in cases is similar to our population with one exception. The LTDHD population is 8% African American and the COVID-19 cases are 11% African American. This just means that a higher percentage of COVID-19 cases occur in people of color. The most common symptoms are cough, feeling feverish, body aches, fatigue, and shortness of breath. A total of 59.6% of our cases have a pre-existing medical condition and 13% are current smokers. The most prevalent chronic conditions are chronic lung disease, cardiovascular disease, and diabetes, which is consistent with Kentucky's population. There have been 47 people hospitalized, 20 who were in ICU, and 14 that had to be intubated. The range of illness duration is anywhere from 0 for asymptomatic cases to 71 days, with the average being around 14 days. We compared people with critical disease to people with mild disease to determine significant risk factors. After adjusting for age, we found that significant risk factors for critical disease were cough, shortness of breath, any pre-existing medical condition, and diabetes. An epidemic curve is a visual display of the onset of illness associated with a disease outbreak. The EPI Curve on the screen depicts the COVID-19 cases in the Lincoln Trail District by date of symptom onset or the diagnosis date for asymptomatic cases. The red line indicates the 14-day rolling average. I have also added significant actions taken by the governor. Our first case began showing symptoms on March 1st, and cases grew quickly until around week 14. As businesses began reopening, we have noticed an increase in cases, demonstrating the possibility of a second peak. We expect to continue to see some peaks as we would with any person-to-person transmission. This should not be surprising or cause alarm. Instead, this information should serve as a reminder that COVID-19 is still very present in our communities. It's important that we continue to practice physical distancing, wear our cloth face masks when out in public, and frequently wash our hands. These simple steps will help reduce the spread of the virus and help to protect our loved ones and our communities. The most up-to-date information can be found on the COVID-19 Latest Updates tab at ltdhd.org or on the LTDHD Facebook, Instagram, and Twitter pages. Thank you.